You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. I am so excited about today's episode. We are going to shake things up a bit. We're doing something very differently than we normally have. So for the last 2.5 years, we have pretty much solely interviewed healthcare influencers, early adopters, or innovators themselves. And I read the Bezos Letters a while back last year, and I just thought I would love to have Steve Anderson on the show so we can pick his brain and find out a little bit more about how this even came about. And then also to be able to learn, I think there's a lot of wisdom that we will be able to learn from his book that apply to the healthcare industry. So without further ado, welcome Steve Anderson, the author of the Bezos Letters. Welcome to the show.
Roxy, thank you so much for having me. I'm looking forward to our conversation.
Yeah. So let's just get started by telling our audience a little bit about your background and then how this book even came about. I think that's such an interesting story.
Sure. So I come out of the insurance industry. Early in my career, worked for two different insurance agencies selling insurance primarily to businesses. And during that time, I also developed a real interest in technology. And so shifted in 1999 to starting my own firm and starting to help the industry, primarily insurance agents and brokers, understand all this new technology that was coming and how they could apply it to their own organization. And, the last 25 years I've been doing that. Well, I probably should actually figure out the date, but probably about 3, 4, or 5 years ago, I was really looking at all of the technology and how rapidly it was changing and started asking the question, is the biggest risk an organization faces actually not taking enough risk? And because technology is changing fast, organizations didn't have the time they used to have to kind of figure things out, right? It was just happening at a much, much faster pace.
Yeah.
And so exploring that question, I started looking at businesses, not just insurance, but just businesses that had made the transition well and those that had not. And, some obvious names now, I think, BlackBerry, Blockbuster, Sears, Kodak, all struggled with technology changing on them and their core businesses being really decimated. And they took too long to pivot and change. And then looked at companies that had done it well. And that's where I came across Amazon. And certainly known as an inventive and innovative company. And I discovered the letters to shareholders that Jeff Bezos started writing in 1997 when they first went public and wrote every year, actually up until last year now. The book covers up to 2018 letter, which was published in 2019. And what I discovered in that was principles that I believe that Bezos and Amazon use to grow that I think could apply to any business, regardless of it, whether they sell stuff online or retail stores or other types of businesses.
So it's interesting to me how this path has really transformed and changed your life. And I mean, I know it's not one letter, but it's a shareholder letter from 1997 by one man has just really transformed your life. That's just really incredible. And what a brilliant idea where you were able to translate these shareholder letters into these growth principles. So how did that come about? And what was that like for you?
So early on, I literally read a couple letters and thought, wow, there's a lot of really good information here that I think, again, any business could use. And so I actually created that first step was creating a one-page summary of each of the letters, kind of key metrics, sales or number of customers, and then key quotes, and then kind of takeaways. How can this apply? And I actually was going to created it as a PDF giveaway, right? Give me your email address, lead magnet, whatever, however you want to call it.
Yeah.
And fortunately, my wife has been in the book publishing business for a long time, and sent it out to a couple of people, including her. And she immediately came back and said, "This is a book. This is not a giveaway." And so that started the process of writing the book. And in kind of a quick story there, even that shifted, because I started writing, the book in chronological order, right? 1997, he said this, 1998, he said this, et cetera. And because I am fortunately married to a brilliant author and book strategist, really. And at one point when I gave the, really first kind of manuscript draft to her, and she came back to me and said, I need to talk to you. Well, as a husband, that maybe not always a good thing.
Right.
And so we sat down, and she basically looked at me and said, "This is really boring. Nobody cares what year he said what.
Uh-huh.
Are there principles that you can extract out of this that people can, take and apply, and we could do it?" And so that was the shift. And I was devastated for a little while, right? My little baby was ugly.
You have to rework everything.
Well, and that's what I thought. And fortunately I didn't, because I had all of the germs, the kernels, the nuggets there. We just reformatted it around principles and 4 cycles. So the 14 principles are grouped into 4 different cycles: test, build, accelerate, and scale. And, that was brilliant on her part. And I think really is what is resonating with people, that it's easier to digest, easier to consume, and easier to understand.
Yeah, absolutely. So I think for most of the people that would be tuning into this are in healthcare, like I had said in the introduction. And so the first question I have for you is, does this apply for healthcare?
Well, the easy and short answer is, of course. The longer answer is how. And, that really is looking at, some of the principles. And I'm going to pick out just a couple of them. I'll ask you to pick out what you think might resonate. But I'm going to start with principle number 1 in the test cycle, which is encourage successful failure. Now, I'm sure some people just kind of went, "What?" Right?
We can't do that.
We can't do that. Patients. Right. We could kill somebody. My son-in-law is a medical physicist. So, again, I remember him early on when they were dating, saying something like, "Yeah, I need to kind of make sure the radiation is right, because if it's not, we could kill somebody."
Right.
So I do get that you need to be careful. And if you're not experimenting with something new, and I think about all the medical advances, right? They started out as, "I wonder if," or "let's try this experiment."
Yep.
And from Bezos' perspective, that's actually the core at Amazon, is invention. And he said that, you may have read that he announced he's stepping aside as CEO and moving into an executive chairman position. But in his email to employees announcing that transition, he said, Amazon has been successful. What's the key to our success? Well, he says it's invention, which I think is very interesting, right? Because we talk about innovation and we talk about all these things. But what he goes on to say is that, we have invented new things that have become normal.
Yep.
Right? A Kindle e-reader was a new way to consume a book, but is now normal. A review of a product or book on the Amazon website was new, but now I'd say nobody, but most people will look at reviews before they decide on what product they want to buy. So I think, yes, absolutely, you have to be careful, and you have to experiment. And if you're experimenting, you're going to fail. Because if you know you're not going to fail, it's not an experiment. And how you learn from that failure, and that's the phrasing, successful failure.
Yep.
A failure is a failure. Yes, you want to avoid it. And even Bezos says later on that, there's a bad kind of failure. And the example he gives is fulfillment centers. He says, we've built a lot of them. We know how to build fulfillment centers. So if we build one and it's a failure, it doesn't work, that's an operational failure that's unacceptable.
Right.
And the way I phrase it is that Amazon has an intolerance for incompetence. So that's not what we're talking about. But we are talking about, I wonder if this will work.
Yeah.
And that kind of idea of then taking those experiments, learning from them to create something new, I think is a core concept that I think does apply in the insurance area, and especially with the work that you've done, with innovation within that sector of the economy.
I think it's so true. And I hope everyone that's going to listen to this really takes that to heart, because it really determines like how you filter successful failure, right? How you interpret that. We're not talking about half-baked ideas. Mm-hmm. We're not talking about, even the word MVP, minimal viable product, people are like, oh, we can't do that in healthcare. Well, we're not talking about like a car with 3 wheels. Right. It still needs 4 wheels. And so, as long as you are, practicing like the stuff that we know to be true, like around IRB, when we're conducting research and testing things, there's going to be some different guardrails and some different concessions or considerations that we need to make. But don't get so afraid of it that we lose out on being able to make sure that we're building businesses that are sustainable in the long term, because we weren't continuing to invent or innovate because we thought, well, we can't do that because that's dangerous in healthcare.
Yeah, one of the phrases I use a lot is that the biggest risk a successful business takes is their success, meaning they're successful. What got them there, they start protecting, not looking at what's next. What else can we do? And one of the favorite phrases Bezos uses is, what else can we invent on behalf of the customer? Mm-hmm. And I think keeping that in customer, be it the patient, be it the doctor, be it staff, within the organization, what's their friction point? What can we do to help improve what they do and how they do it and the experience that they have?
Yeah, absolutely. So when you and I talked before, you had said, hey, here's an idea, pick one of the principles from each of the 4 growth cycles. And I went to do that. And I was like, oh my gosh, this is so much more difficult than I thought. This is like trying to pick my favorite child.
Well, I always say that. I have 7 grandchildren. So often will get asked, what's the best one, or what's your favorite, or what, it's like, I don't know how to answer that. Right. And I think what's really difficult. It is. And I think what's important there to understand is that principles stand on their own, but they also interact with each other. Mm-hmm. So it's how you connect this one and that one. And I think looking at the principles is, where am I at now? Right. What do I need now? So certainly in the test area, the 3rd principle there is, practice dynamic invention and innovation. And again, I worked a lot on that wording because, again, for Bezos and his thinking, invention is so key and important. What's different at Amazon is they don't have an R&D department. Every employee, literally fulfillment center on up to executives, are expected to be looking at what they do and thinking of ways to improve it. So that's why it's dynamic. And they have built a culture really that takes decision-making down to its lowest level possible, that has the competency to be able to make those decisions.
I think that is so brilliant. And it to me, it's the only way where you can, turn something from nothing into a $1 trillion company, right? That puts a lot of pressure on an internal R&D department, versus having 60,000 people that are working towards that invention and innovation process.
Well, and that's what's key about that successful failure. Again, how these interact is that I'm convinced employees aren't afraid of failure. They're afraid of the consequences of failure. Right? Because most organizations want, go ahead and experiment, but you better be right. Well, if it's an experiment, you're not always going to be right. And so
Right.
what are the either positive or negative consequences to that? Like, and Amazon has a couple of awards, for people who are thinking of how to improve the customer experience or how to improve internally. And though literally the awards are not cash, they're symbolic, but really key to drive that culture within the organization.
Sure. Yeah, absolutely. And that's one of the things that has come up very often when I'm talking to corporate innovators of how do they create this culture of innovation, especially in healthcare where it's not been so common. You're not necessarily hiring people that think like that have that natural inventive mindset, but who are so much more immersed in those challenges, those day-to-day challenges. So they're better experts than the people at the top to ideate on what those solutions might be. So this is kind of skipping a little bit because I know culture is around more in like the last growth cycle around scale. But I think, like you said, they're intertwined together. What is an organization need to do to really be able to get to shaping that full staff R&D culture?
Yeah, I think a couple comments I'll make on that, and that you're right. That's in the scale cycle where I talk about maintaining your culture. And, Bezos talks again a lot about culture, and, the way he phrases it is you discover your culture, you don't create your culture, because you have a culture and you can impact it. So Amazon does a lot of things around that. And one of them is they have 14 leadership principles. Mm-hmm. And again, these are their, kind of how we operate as a company, as a business. And there are some crossovers between the leadership principles and the growth principles. Not as many as I thought there might be, but for example, the culture that they create, even in the shareholder letters, the typical name for somebody who owns a piece of stock is a shareholder. Bezos started in probably about 2004, 5, or 6, calling them share owners, right? And so, and he says in his very first 1997 letter is, getting the right employees are going to be key to our success in the future. And therefore, they must be owners. They must think like owners.
Yeah.
And actually what he said is they must think like owners, and therefore they must actually be owners. And so their compensation plan for employees from the very beginning has been, yes, competitive, but not top salary, but that kind of stuff. But their compensation was defaulted to stock options, right?
Well,
so
who wouldn't want to be a share owner of Amazon?
Because Amazon, especially now, right? Now, those first 10 years or so, that was a question. Do I even want, right? But especially now. So that's part of that culture. I think part of it is really encouraging experimentation. And, one of the things I talk about to try and explain that is, what is your organization's award for an employee that has the most successful failure? Meaning, what did they try that was crazy and it didn't work, but it was a crazy idea that might have worked? In fact, most of Amazon's big bets, what he calls big bets, Prime, Marketplace, AWS, all started as failures. Mm-hmm. But what they learned from those initial early failures grew into something really big.
So I think that this is so foundational. And I'm going to go out on a limb and say, I cannot imagine any innovator, any healthcare leader that I've ever come across at any level with any organization across the country that has that type of reward system. Mm-hmm. and in my mind, that Amazon, and I think a lot of people know this, that Amazon is the sleeping dragon when it comes to healthcare.
I absolutely agree. Yep.
It is the most, the biggest threat to disrupting the status quo in healthcare. And, so taking heed to what you just described, I think is so fundamental. You've got Amazon, who understands tech and how to leverage it, how to leverage data, and really understands consumerism inside and out. Three things that healthcare really, really, as a whole, struggle with.
Yep.
But then you have Haven.
Yep.
And so what happened there?
Well, I certainly have my opinions. I'm going to also say, kind of like you, go out on a limb and say, Amazon is not trying to disrupt healthcare.
Okay.
They are trying to invent on behalf of their customer a better way. And as a result, healthcare will be disrupted. Mm-hmm. But their purpose, their goal is, oh, gosh, let's go after healthcare. I don't believe that.
Right.
Disruption is a result or a byproduct of invention. So pill pack, right?
Yep.
Acquired pill pack, pharmacy, different way, solving a problem for those that take multiple medications, trying to make sure they take the right one at the right time, right day, right time, et cetera. A much easier way than having, your little pill dates and, all of the stuff that's out there now, taking all of that friction away. So I'll go to Haven. I think the problem with Haven from the very beginning was it wasn't just Amazon. And your comment back, Berkshire Hathaway, JP Morgan, don't have the same culture and mindset that Amazon does. And so it's, hindsight's obviously a little bit easier, but had I really thought closely about that, I probably could have predicted that early on, that its chances of success are much harder because Amazon just has such a different culture around solving problems for their customers.
Yep. Yeah. So I think to that point, the other thing I think a lot of these tech companies believe is that, that healthcare just doesn't understand tech and data and consumerism, and we'll come in and we'll be able to, we understand that we'll be able to come in and service our customers in a much better way. And they have a tendency to underestimate the complexities of reimbursement and regulatory, right? And I think that, that whole aggregate of the power of Haven thought that they would be able to wield some influence much more than they were actually really able to do in changing how things work in healthcare. So I think go ahead. Yeah.
No. You finish your thought. Then I was going to say,
I think the message is that, if for the inventors and the innovators to really grab a hold of these growth principles, because it is almost, I'm even going to say it, a sure path. Like if you can figure out the technology, the data, and the consumerism, like that's your path to profit. That's your path to make sure that tomorrow Amazon doesn't come in and just completely demolish your business and you're, left on the same shelf as Blockbuster and Nokia.
Yeah. So this is related. So in the accelerate cycle, one of the principles is make complexity simple. And based on this discussion, I think you might be interested in how I came up with that thought. So it was when Amazon purchased PillPack, around $1 billion. Obviously, big news. The stock of the three largest drugstore chains, I don't remember the numbers now, but dropped significantly just on the fact that they acquired. And I remember listening to I was in the car listening to probably NPR show or something. And one of the CEOs, I think it was Walgreens, but I don't remember that. I'd have to look that up actually. But he said on an earnings call, we're not worried about Amazon because it's much more complex. Pharmacy, right? Drug delivery is much more complex than Amazon realizes.
Yeah.
And I laughed out loud.
I did.
And literally the thought that came to mind, that's what Amazon does, is make complexity simple. And, coming out of the insurance industry, I think like healthcare, there is a reliance on regulatory barriers to kind of self-insulate or protect, or and that will last for some time period until maybe somebody else besides Amazon figures out, a different, better, more streamlined way around some of those traditional regulatory barriers.
Well, nothing like a global pandemic to help be a catalyst.
Well, I mean, you thought
transformation.
You talk about trends getting accelerated. My goodness. Yeah, very much so.
Yeah. So all the stodgy regulatory and reimbursement that they've been used to insulate and protect themselves all of a sudden gets demolished in warp speed during a global pandemic. Now the jury's still out on how much of that gets resurrected, right, in the next year. But it will surely be interesting.
It will certainly change.
Yeah.
How much or how fast certainly is up, but I think there's no question it will change.
Yep. So I want to make sure that we have time to talk about another growth principle that you had in the build cycle around obsession over customers.
Yeah. Again, 1997 letter, Bezos talks about obsessing over customers, or customer obsession will be a core tenet of what Amazon does. And again, it has. And, again, it's, was talking in one interview where the host said, well, customer obsession, I think we all assume we know that. And I came back later and said, I'd like to revisit that, because I think too often businesses talk about customer focus and customer journey and customer experience and customer service. Amazon talks about obsession, which is just a whole different level and word to use about what Amazon does. And that obsession is why we have one-day delivery, right? Because 3 customer pillars for Amazon are wide selection, low prices, and fast delivery. Now, that probably is not those same pillars for a healthcare provider.
Yep.
But, what are your pillars, and are you obsessively figuring out how to invent on behalf of the customer? And the phrase I like to use is take friction out of your interaction with a customer. Well, I can tell my experience with a lot of healthcare providers, there's a lot of friction, like filling out the same damn form every time I go for an appointment. I mean, hello, come on, right?
Or them giving you 10 forms and a clipboard, and you've got to put your name and address and phone number.
All 10
forms.
That's right. And I did have one, frankly, that gave me an iPad, right? That, again, what are the things you can do to make that experience the best it can be? And you do that by obsessing over those small details.
So and I think to your point, there's a lot of healthcare organizations that have some mission statements and vision statements and some plaques and whatnot about this core value of focusing on the customer and putting the patient centric, right? But it's a big difference to talk about it, say it, hang it on the wall, than it is to actually live that out. And from my perspective, I would say that the industry has transitioned to being more technology focused than customer focused. So now it's like really exciting AI, artificial intelligence, telehealth, virtual care, all of this tech that's getting so much attention that is absolutely usurping the obsession with customers.
Yeah, and I think that can be, and I think that's, not understanding how the technology supports the customer, and replace it. And, again, that's a core tenet. And again, I go back to that phrase, inventing on behalf of the customer. What are you doing to do that? How are you thinking about that? How are you even identifying where the customer has a problem that needs a solution. At Amazon, they actually have a process that I think is one of their really secrets to making this work. And it's
That's why you're here, Steve, to give us the secrets.
I'm trying. And it's called a 6-page narrative or a 6-page memo. And short history, in 2004, Jeff Bezos sent out an email to his senior leadership team and said, no longer will anybody give a presentation in a senior leadership team meeting using PowerPoint or Keynote. Slide presentations are banned. What they replaced
that would be the death of so many companies.
And then, and what he said, and I'm paraphrasing now, what he said was, people hide behind bullet points and haven't completely thought through what it is they're actually proposing. What he said is, you will create, and this is the process in place today, you will create a maximum of 6-page written memo. First thing you'll do is create a future press release. So for whatever you're pitching, whatever idea, product, service, platform, you write the press release for the day it's released to the public. And again, there's some components in there. I won't go through all of those, but one of them is, what's the benefit to the customer? Why is the customer going to like this? And you use that as a roadmap for actually creating the product. And then you go on and you create an FAQ. What are the questions people are going to ask? And from the customer questions, maybe internal operational questions, and you answer those questions. And there are 2 answers. There's a short answer, can we do this? No. The longer descriptive answer is, here's why not, or here's our plan for the future.
Yeah.
And that is not handed out before the meeting. It literally is passed out as paper to the participants in the conference room. And the first 10, 15, 20, maybe 30 minutes, depending on how big the project is spent reading the memo.
Wow.
Bezos calls it, it's like study hall. And he said, executives are busy. They're going to say they read it and they didn't, or they didn't spend enough time. So we're going to carve out this time to focus just on this. And then we discuss it, not people going through. And although, how you do presentations sometimes and somebody will interrupt with a question. You go, oh, I got that in the, next two more slides. Hang on. None of that happens.
Right.
And they're writing notes in the margins going, okay, what about this? Where'd this data come from? So now your discussion is much more fruitful and helpful. Yeah. Again, culturally, really hard to do. But at Amazon, that is what's done. And part of the benefit is, one, to slow down, to speed up. Actually, Andy Jassy, current CEO of Amazon Web Services, new CEO of Amazon everything. I heard him in a speech, and he talked about why this is so powerful. And he said, a lot of times programmers, developers will go in and create all of this stuff and then get to the end and realize it's not solving the problem they thought it was going to. If they had spent more time thinking through all the problems, all the issues, what problem is this going to solve? How are we going to do it? They would save tremendous amount of time throughout the project. So it is this idea of slowing down to speed up.
I love that. I feel like there's so much we could unpack for days just in what you just said. My brain is like pop rocks right now.
Well, and I mean, and I've been trying to help think through with businesses, how do we introduce that into a culture that's never even thought in. And I think what you do is you do it in the smallest team possible, meaning it might be just, you and 3 direct reports, and you start doing this and experiencing the benefits and learning from it, et cetera. And I tell you, I'm starting a new business, I'll say that. Yeah. And I use this process to pitch to investors. And it was awkward. I mean, all kinds of stuff to do it. I learned so much, and I ended up with 7 significant investors out of it, just because of how it helped the discussion move faster when we took the time up front.
Wow. That's incredible.
Yeah.
Absolutely. So a couple more questions for you. Let's talk about the acceleration growth cycle, because we haven't talked about that. Accelerating time with technology, and then we will open it up for Q&A.
Okay. So this really is kind of that core idea I talked about, with technology developing much faster than it ever has, and how you can use that technology to literally accelerate time, right? It's that idea that, the days are long and the years are short, and right, all those kind of comparisons that you can make. Technology is, key at Amazon, and it is core to what they do, but they don't let it overshadow other things. And so, looking at the Kindle, let me look at the Kindle, right? So that was Amazon's first hardware project. And that actually was developed in what's called Lab 126, which is their hardware, I hesitate to call it R&D, but a separate place where Echo came out of, and a lot of hardware stuff is coming out of. And Bezos talks about it. It was released in 2007. They spent 3 years prior working on it, but using that technology, again, to accelerate the consumption of information, e-ink, and actually probably the best technology in the Kindle is Whisper Sync. Hugely complicated. So I can have a book open on my phone, on the Kindle app. I can go to my iPad on the Kindle app and make either automatically or force, right, syncing to the last place I read.
Yeah.
Technologically, extremely difficult, because my iPad could be idle for months.
Yep.
But Amazon has to know that. And they have to figure out, okay, which is the latest version, and where have I read, to the particular point in time. But they're using technology to help people manage their time better. And I think that's the core concept there.
And who doesn't need that? Right. Right? I mean, it's like the biggest shortage we have is time.
Yeah.
Yeah.
And I another example that just jumps to mind is, again, you mentioned telemedicine. I had the experience of having a annual checkup, and normally I would go down to Vanderbilt University and spend like 3 hours and see probably 5 or 6, 7 different people, and time consuming, and sometimes I would skip it because it wasn't all that important. And because, again, one of the changes, we did that with telemedicine and Zoom, and everybody was on the same call.
Yeah.
It was like 35 minutes, and it was like, and my daughter does the same thing. And it was like, oh my gosh, that was so much more efficient, right? Again, your example, taking the industry, kind of forcing them, whether they like it or not, to try new things. My experience is like, I don't ever want to go back down into an office and sit there for 15 minutes waiting for the next person to be able to come in.
No, not at all. And here's the other thing I've noticed, because I've experienced it a handful of times, is that if you're in the doctor's waiting room, you might have to wait 2 hours. They won't make you wait 2 hours on a Zoom. They are so much more timely on a Zoom session. So it is definitely a big value add to the customer.
And I think that's an example of a trend that's not going back. So again, it's learning, okay, well, how do we do this now? And I also want to emphasize, there are times when you actually need to see somebody. Right. So it's not replacing everything, but now we can better utilize resources, knowing when we can do it virtually and when we need to do it in person.
Yeah. Yep. Absolutely. So I love what Michael Hyatt said in the foreword of your book, where he really described reading your book as an opportunity for the readers to be able to almost like personally have Jeff Bezos as a business coach. And like the light bulb went off and I go, oh my gosh, who wouldn't want that?
Right.
And then to have you as the translator, right? To be able to translate all of those ideas and strategies and principles that were in those letters and translate it into something that we can easily digest and consume and apply is just absolutely brilliant. And so I want to encourage everyone that is listening and watching to go out and buy a copy of the book if they haven't already.
Well, thank you.
Yeah.
And if you pick up the book, be sure to go to thebezosletters.com because there's some additional resources there, workbook. And really the point was trying to help you apply what I talk about, not just, okay, it's a, good read or that's interesting, but actually take those and do something with them.
Awesome. Well, I'm glad that you said that because that was going to be my next question was as we wrap up on the session is how can people get a hold of you? Do they just reach out to the website? How do they connect?
Yeah, well, first place for the book. And again, we've been fortunate with some great success. New York Times, Wall Street Journal, not New York Times, Wall Street Journal, USA Today bestseller. And we now have 18 languages that it's being translated into. In fact, I kind of chuckle. Just this week, we got another contract from Albania. So it's going to be translated there. So it's like, I had to look up where it was, right? So, but it does have international interest in it. And we're really happy with that. I would say the other place is I'm very active on LinkedIn. Mm-hmm. And so if you want to reach out there and connect, I think that, Roxy, that's where you and I ended up connecting.
Yeah, it is.
I'd be happy to let me know that you listened here and be happy to connect with you there.
Awesome. Thank you so much for sharing your wisdom and your insights with our audience today.
My pleasure.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.